Today on Veterans Stand Up, I'm talking about community care with Ed Weinberg, Army veteran and President and CEO of Optum Serve Health Service. Well, Ed, let's give some context. What's the focus and mission of Optum Serve?
Yeah, thanks, Paul. And first of all, let me just say thanks for having me on. Really appreciate the opportunity to share a little bit with the veteran community. Optum Serve was born about 5 years ago. It really is the federally facing front of United Health Group, which is a Fortune 5 company. The things that we do really focus on the military and the veteran community, but also others that are either keeping America safe or keeping America running. What we do within Optum Serve Health Services, my part of the business, is really focused on all of the occupational health exams, things that have to do with the provider network, and really making sure that military service members, veterans, and others are able to get the care that they need.
And one of the things you do for veterans through the VA is you work on the community care network. So I want to ask about that and your role, but let's begin by talking about what is it for folks who don't know.
Sure, yeah. Community Care Network is our largest program. We were awarded 3 of the continental United States-based regions, 3 of those out of the 4 in 2018. And we started implementing in 2019 across 36 states, Washington, D.C., the U.S. Virgin Islands, and Puerto Rico. Essentially, we do 3 things through VA Community Care, which is really, you can think about it as an extension of the VA itself. The first thing is we have a robust and quality provider network. That's everything from primary care to all of the various types of specialty care, as well as complementary and integrative health services. You can think of things like Tai Chi, massage therapy, Native American healing, and then we also have a dental network and a pharmacy network. Beyond that, we do customer service. So we make sure that we've got call centers and portals that are available to not only serve the providers and the VA staff, but also the veterans out there as well. And then finally, we do all the back-end work in terms of making sure that any of the claims that are submitted by the providers, they're paid timely, so that we can make sure that the network stays in place for veterans in the future.
Okay. So let's go through some of the frequently asked questions and just talk about the journey of the veteran. So one of the things that comes clear is the importance of a referral. So talk about that.
Yeah, sure. Everything that happens in the community from a provider and a veteran standpoint has to be authorized by the VA. And so it's very important that the referral for care that's issued, the veteran actually take that with them to the provider. Oftentimes what we see is that the provider may bill on the back end and they're not sure that the veteran was actually there because they're a veteran using their community care benefit. So they may bill what they've done previously, either through other health insurance or through perhaps their Medicare benefits. So really important that the referral is with them. There are 2 types of care that don't require a referral, if you will. One is emergency care and the other one is urgent care.
Right, I was going to ask about that because it's standard care, but you also have situations like you're about ready to describe.
That's right. And so for emergency care, I would say for a veteran, one of the most important things that you can do, certainly you or a family member, is make sure that that provider notifies the VA within 72 hours. That makes sure that the eligibility is not encumbered on the back end. The other thing is for urgent care, there's a whole lot of information on the VA's website, va.gov, where I would recommend go and download the urgent care card, which has very specific information depending on the region that you're in. You need to know what types of things, the information you need to have as you walk into the urgent care, but also that urgent care center really ought to call the phone number to make sure of eligibility before you receive the care within their facility.
Okay, and everyone's favorite, the explanation of benefits. It's not a bill, but talk to us about that.
Yeah, it's not a bill. It says that on there, but sometimes it can be tricky. Really, the explanation of benefits is just telling you what portion of the cost is actually being applied to your benefits. So it's important for you to understand. It's why the explanation of benefits is sent. One of those is triggered every time that we pay a claim from a provider that comes in. If you've got questions though on the EOB, the explanation of benefits, there's certainly information that you can receive either by going to our portal if you're in one of the 3 regions that we serve, at vacommunitycare.com, or you can certainly go in if you think that you need to and submit an appeal. There's forms also available on our website for that purpose.
Well, that was a good segue into my last question. If folks want to learn more about community care or some of the things you described, where should they go on the web?
Yeah, certainly. So va.gov is definitely the first place that I would go. They've got links to all sorts of information, to include fact sheets. And then, of course, if you're within one of the 3 regions that Optum serves, you can go to vacommunitycare.com to learn more.
Thank you.
You're welcome.